Now we move on to our first session on public health, exploring the diverse career opportunities in public health and health promotion by Pegeen Walsh. We're really, really happy to have you here today. Thank you very much for coming. Briefly about her. She is an instructor with and developed the curriculum for the health promotion component of the bridging program, Alternative Careers in Health Promotion and Education for internationally trained physicians, hosted by the Learning Enrichment Foundation. As a former executive with the federal and provincial government and nonprofit sectors, she oversaw the design and delivery of a wide range of programs, policies, partnerships, advocacy, and research that supported individual and community health and well being. In her past leadership roles, as Executive Director at the Ontario Public Health Association, Director of Chronic Disease Prevention at the Ontario Ministry of Health Promotion, Ontario Regional Director at the Public Health Agency of Canada, and Health Canada. She led such initiatives as climate change and health, prenatal health, early child development, seniors, injury prevention, HIV/AIDS, SARS airport screening, Aboriginal Head Start, Smoke Free Ontario, the built environment, alcohol misuse, chronic disease prevention, healthy eating, and healthy equity. A round of applause for that. So she values volunteering as board member of Bellwood Centers for Community Living and co-chairing its Community Advisory Council. I hereby welcome you to have the stage and share your expertise as a public health personnel myself. I'm very excited for this lecture. Thank you.
So good morning, everyone, and welcome. I'm really honored to have been invited to come to this session. I do teach an online course, and so I see that we have a lot of people online. So I am keeping you in mind as we go throughout this session. And so I'm assuming that people have the ability to put comments and questions in the chat box. So perhaps if you can keep an eye on that for me. And this session is 45 minutes. And while we had planned to have questions at the end, I do welcome questions and comments throughout. And if I find we're getting a bit away from some of the areas I want to cover, then I'll just mention that to make sure we get through the presentation. So today I want to talk about health beyond healthcare and to explore those career opportunities in public health. I'm going to talk about what is public health, what kind of a career you can have, what the opportunities look like, what kind of skills you'll need. And I hope by the end of my remarks that you're going to see how critical this area is and consider it as a possible avenue. Look at ways that you can transfer the incredible skills and experience that you have into this exciting field. So as mentioned, I'm going to start out with a bit of background because in any job interview with public health, people want to make sure you understand the concepts that are behind it. And well, what do people think who work in this field? Why do they go into that field? What kind of positions? We'll go through some job titles, what kind of skills you'll need, and then the kind of skills I presume that many of you have that are easily transferable into this area. I can give you some examples of opportunities that are open right now, so we can go through those and look at, well, what would be required to apply for that kind of job. And then at the end, I've provided some training, some free online training that you might find useful, some tools and different kinds of resources. So to start out, I just wanted to ask you to do a quick poll, if you wouldn't mind getting out your phones. And for those of you online, you'll see a poll come up on your screen. And we'll just take a moment to answer these questions in terms of what do you think are the most important factors that influence your health? Is it our genes and biology? Is it socioeconomic factors? The healthcare system, having access to those services? Is it the behaviors? Is it our health behaviors? Or is it the physical environment that we live in? So just to choose one factor that you think is the most critical. Okay, so what we're seeing here is that a few people are saying, you know, it's really about our genes and biology, and we can't control those factors. Others are saying it's about the healthcare system. Can we access those services that are going to keep us healthy? Others feel that it's the way we behave. Is it about healthy eating, being active, or is it the environment in which we live? And a large number of you recognize that social and economic factors play a huge role. And I'm pleased to see that because that's what we're going to talk about. In public health, we're very interested in those root causes. What are the non-medical factors that are going to keep us healthy? So there's been a lot of research done internationally and in Canada to understand what are those factors. And this pie chart shows you that those socioeconomic factors, in fact, play 50% of the influence of our health. So more and more studies are coming out showing those of lower socioeconomic status tend to have poor health. And we're further research to understand, well, why is that? And what can we do about that? So I think for some people, they find that surprising that the healthcare system, while it does play a critical role and we need it there, and we often feel like we need more services, but how do we keep people out of the healthcare system? How do we tackle those other factors that are going to promote health and well-being? So in public health, we not only look at the World Health Organization's determinants of health, of course, we need to be living somewhere where it's peaceful, where we have shelter, where we can have food and income, and we have sustainable resources, social justice, and equity. So we know these are prerequisites to health. But on the right-hand side, you also see this rainbow. And this is really showing you what we could describe as the determinants of health, how all these factors layer upon layer influence our health. You can see in the yellow, the individual at the core, and of course our genetics play a role, our gender, our age. We also see those behaviors. They are really important and critical to our health. And we see the kinds of services that are out there, be it access to health or access to other infrastructure such as recreation, education system. And then what about where we're living and working and studying? Is that promoting our health? Are we getting a decent wage? Do we have access to clean water? And then on a broader scheme, what about those socioeconomic and political factors? Do we feel a sense of agency? Are we experiencing racism? Are we experiencing poverty? And what role does that play around our health? So I mention this because if you go for an interview in public health and you don't talk about the role in terms of health, people will be concerned that you're bringing a narrow view of health. And you'll notice when I talk about health versus healthcare versus public health. So in Canada, we have a public health system and it is separate from our healthcare system. And that's really important because sadly, what we're seeing is the majority of resources go into healthcare, and that is critical, and we don't want to see that diminish. But unfortunately, only about 2% of provincial health budgets are spent on public health. So what does public health look like and how does it influence health? So I want to just talk a bit about what I see in my own community. So I'm excited to be here because I actually studied at the University of Waterloo and I'm from Kitchener. So it's nice to be in my hometown, but for many years now I've been living in Midtown Toronto. So I want to describe a bit a day in the life so you can see how public health is there, but so often it's not really visible to us, yet it has a huge impact. So I'm getting up in the morning and I'm thinking, okay, I'm going to go to the gym. I like to work out. But, I'm going to wash my face before I head out. And as I'm washing my face, I'm thinking, wow, we take that clean water for granted. Yet we know in parts of Canada and in Northern Ontario, there's some boil water advisories and other parts of the world that clean water is so fundamental to our health. Then I'm brushing my teeth and I'm thinking about my recent dental appointment and how expensive it was. I was shocked. And I thought, thank goodness I have access to a former employee's dental program. And thank goodness public health advocated for access to free dental care for children. And our chief dental officer in Ottawa at the national level advocated for a dental program across Canada so that low-income people can get access to good oral health because it is fundamental to overall health. So now I'm walking out the door and I'm walking by this beautiful wide boulevard in our community on the way to the gym. And it's a place where the community gathers, where children play. And we know from public health doing research about the health benefits of green spaces. There's also play structures. We know how important recreation is and having access to our children. So again, public health is active in promoting the importance of a green canopy to not only absorb those CO2 gases, but also to promote our own mental and physical well-being. So I'm walking another block and then I see the school where my daughter went to grade 7 and 8 and it's being renovated. And I think, oh, thank goodness in grade 7, 8, she was one of the first cohorts that got free access to HVP. So to prevent cervical cancer. So this is fantastic that she got access to that and that awareness has been built about how vaccination and immunization can make a difference. She also was one of the first groups that was required to have 20 minutes of physical activity every day on top of the phys ed. When I started at OPHA, many years ago, I was delighted that the Ministry of Education approached public health officials like myself and my colleagues for advice about the health and physical activity curriculum as they were updating it to make sure it included things such as sexual health. And so that my daughter would not only be learning about substances, but also how to maintain sexual health. And while you could say, wow, that's a young age in grade 7, but we know kids need that knowledge at an early age. So now I eventually arrive at the gym and I'm going through my program and I'm doing sumo squat jumps and I'm doing lunges and I'm doing step ups and I'm doing an exercise where I lie on the ground and I have to get up 10 times. And as I'm doing that, I'm thinking about my now deceased aunt of 96 and how she had many falls. But fortunately, as the hospital saw that record of her repeated return to hospital, they launched a health promotion initiative for injury prevention for seniors. And I'm thinking, this is great that I'm doing these exercises so that I will maintain my core strength, weightlifting, and be active. Plus, every day I feel great because I'm working out. So again, in public health, part of the mandate of public health units, for example, is to prevent chronic disease through physical activity, healthy eating, and what have you. So now I'm I'm leaving the gym, but I am thinking, wow, I'm so lucky. I found this inexpensive place, but what about other people? Why isn't that integrated in our health system? When I walk by the family health team in our neighborhood, I'm thinking, wouldn't it be great if they could integrate in that team physical activity specialists, registered dietitians, so people can get easy access to this kind of knowledge and be active. So I'm walking down the street, I'm going by my hairdresser, and I'm thinking, oh, I'm so glad that public health is inspecting the hairdressing salons so we know that the tools that are being used are safe. There's something like 5 or 6 nail salons. I don't know about in your area, but they just seem to be expanding. And again, those are being inspected by public health. I look at the corner store and I'm thinking about all the work that public health advocates did for decades to create Smoke Free Ontario. So that you go in that corner store, kids don't see cigarettes. It's been denormalized. They're hidden behind. Their age is checked before they can purchase cigarettes. And there's no smoking in those public spaces. What a great feat achieved by public health advocates across the country and in Ontario in particular. So I'm walking by the pharmacists and I'm excited because the gentleman I've gotten to know, he's from Iran. He was able to get his credentials recognized. And so I had been there for my flu shot and my COVID shot. And I thought, wow, it's made such a difference opening up vaccination through a pharmacist. It's so easily accessible. And guess what? We've seen increase in immunization against flu. Now, COVID, that's a whole other story in terms of the incredible work that public health did to keep us all safe. And it's sad in some sense because people don't really want to talk about what happened. But sadly, so many vulnerable members of our community did lose their lives. But in comparison to many other countries, we did very well in Ontario and in Canada. And again, critical role played by public health. And sadly, now feeling a bit misunderstood, a lot of misinformation too about vaccination. So I'm almost home. I'm going by the grocery store and I'm thinking, oh, thank goodness again for the hard work of public health so that when I go purchase something, I can see, is it high in salt, high in sugar, high in saturated fat? So that was a long struggle to get that front of packaging. And I know the Heart and Stroke Foundation has been working with a whole range of public health advocates to try to restrict marketing to kids. And they've come so close to legislation on that. So that work will continue to make it easy to eat healthily. And one of the really proud achievements that we did at the Ontario Public Health Association was to make sure when you go into a chain restaurant, you will see information about those calories. So you have an awareness about what is appropriate amount of calories for an adult or a child, and what do I see on the menu. So now I'm almost home. And as I come into my house, I'm thinking about the newspaper, and it's going to give me good information about UV so I can protect myself. It's going to give me information about air quality. Again, things that public health have advocated for to ensure that's there. There's all kinds of other things. When you see up here, I've talked about protection, I've talked about promotion, and I've talked about prevention. So those 3 Ps are critical to public health. And I'm about to join in a conference call with colleagues from the Bellwoods Community Center for Independent Living. So I've been doing some advocacy work with those who have physical disabilities because they're feeling that those barriers could be removed and their needs are not being met. And so I know that being a retired person, having social connection, having purpose, meaning, and contributing is also really critical for health. So these are, I've tried to show you through my day, just thinking about my community, all the ways that public health is making a difference in people's health, getting at that root causes through public policy, through individual action, through working with groups, through spreading knowledge and awareness and doing research. So as we go through this, I hope you'll keep in mind, yeah, I don't know how many of you have really thought about public health or aware. For example, do you know what your local public health unit is called? Do you know where it's located? Have you benefit from the services? For example, when I was, after I had a baby, I was so excited to be able to go and meet other moms and get information from public health so that I could survive, especially those early weeks. So I've just touched on some of the critical areas that public health is involved with. I wanted to talk about Canada's public health system. So again, we have a healthcare system in Ontario, but we also have a separate public health system. So I'm wondering if you would mind just reading for us the purpose, aims, and what some of those functions are, since you have a background in public health.
Okay, so the Canada's public health system, the purpose is to achieve optimal health and well-being for all people living in Canada. Very important. And the aim is what the public health system is trying to achieve: enhance the health status of population, protect against health emergencies and mitigate the impacts, and achieve equitable health outcomes. And the essential public health functions is in how the public health system works to achieve the aims. So, first by health promotion, then by health surveillance, health protection, population health assessment, disease and injury prevention, and emergency preparedness and response.
Great. Thank you very much. So you can see those 6 areas, and you'll see in the appendix of this presentation, I've got more details about what kind of credentials would you need in some of these areas. And I'm going to focus my remarks more on the health promotion area. But I do have a background in emergency preparedness. I've worked in that area. I'm also going to talk about disease and injury prevention. And I know some of you got that background and expertise and credentials around population health assessment and health surveillance. So I'm happy to answer questions or point you in the right direction around those areas, but I thought it easier if I just hone in a few areas where I've had more experience. So again, I wanted to just try to differentiate when we talk about healthcare versus public health, what are the key differences? So you can see in public health, it's very much about proactive prevention. So yes, you might have a disease, you want it to not get worse, so you're trying to prevent that, but that's not primary prevention. You're looking at secondary prevention, or you might do screening tests. So again, that's not primary prevention. You're not getting at, what is that disease? You're trying to understand what are the root causes to prevent disease, injury, and health conditions before this occurs. So on the left-hand side, we see public health is very much about our communities. We're looking at a population level. We talk about population health. We may look at specific groups within the population, but we're not looking at individuals the way that you would in healthcare, where you're dealing one-on-one with people. You might go to a public health clinic that might involve a number of people, but you're doing it because you're trying to overall improve the health of that community. And the kinds of science you're going to use, you're going to look at data, for example, epidemiology. You're going to use social science as well, because you need to understand people, their behaviors, et cetera, versus on the healthcare side, you're looking more at that biological science. And I think the biggest challenge of public health is it's kind of diffuse. As I described to you, when you're walking through my neighborhood, you're not necessarily thinking the way I think. There's a lot going on there. Like, oh, there's public health, there's public health. You're just enjoying the neighborhood and not necessarily appreciating all the ways that public health might have been working to make that community a healthy one. And versus, I think, healthcare, we all understand it. We know what primary care is, what the doctor does, what nurses are doing, where the hospital is, and what have you. So on the next slide. So if you were to ask people in public health, why do you work in this field? What do you enjoy about it? People would say, well, I want to make a positive impact on the lives of others. So I'm sure that feels familiar to many of you because that's what probably motivated you to get involved in health. You want to make a difference. There's varied careers that you can have. I'm going to show you in a minute the different sectors where you can do. You've seen the different kinds of functions that are involved, and people rate, high job satisfaction. Now, in fairness, coming out of COVID, I think whether you're working in public health or other parts of the health system, there's been a lot of burnout and frustration. So not everyone right now is going to necessarily say, I'm really satisfied with my job, but I know the kinds of things that people do in public health, they find very satisfying. And there is that chance to work at that broader level. How do I influence policy and laws, regulations, so that we're looking at those root causes and making a difference for the whole community versus just helping one person. I used to work at YMCA Canada at one point to try to support them around advocacy and public policy. And I said, you'll never have enough services, programs, and volunteers and money unless you're also looking at, okay, why are we finding young people on the street? Why are we finding young people dropping out of high school? How do we look upstream at those root causes and try to influence those? Because this part of dealing with the problem, it's just going to be a very expensive and never ending. Okay, so in the next one, so as mentioned, there's various areas where you're going to find public health. You're going to find it in government. For example, was mentioned, I worked in Health Canada. They have regional offices across the country. The Public Health Agency of Canada is very much that scientific technical agency. Across Ontario, we have every part of our province is covered by a health unit. There are 29 local public health units, and they have a mandate from the Ontario government that's outlined in the Ontario Public Health Standards. So you can read about the work that they do. You'll find in more and more in healthcare. We're finding in hospitals there, as I mentioned, health promotion, injury prevention. We're finding it in family health teams are adding health promotion specialists. We heard earlier from some community organizations that are tackling health issues and using community development and community engagement principles to respond to some health issues. You'll find settlement agencies are also tackling health issues and all kinds of health charities. I mentioned Heart and Stroke, you have Canadian Cancer, Diabetes Association. Also private industry, insurance companies are realizing, okay, we're spending a lot of money tackling health conditions. Is there a way we can prevent that? Pharmaceutical companies, international organizations. I found a number of people that I've been involved with in our program have found some employment with the Canadian Red Cross here in Canada. So not necessarily working on an international level. And of course, we heard about the academic sector, and there's research organizations for those that are really interested in data. So we've got universities, we have colleges, we have an organization called Public Health Ontario, which is sort of like the Centers for Disease Control here in Ontario, a technical scientific agency, and we have Canadians Institute for Health Research. One of them is focused on population and public health. So here's a sample of some of the job titles that you might see. So we can see, I talked about, you might have a title, health promoter, health educator, health promotion planner, a policy health analyst. You might have a leadership role. You might be a supervisor, a manager, a director, an executive director. You might be a global health specialist. You might be a community health worker, a health promoter working on drugs and alcohol, or perhaps working on environmental health. You might be an infectious control specialist, maternal and child health specialist, or working in mental health and addictions, or managing chronic disease and injury, or facilitating community programs. You might be a manager of communicable disease, might be an occupational health and safety specialist, a workplace wellness coordinator, a supervisor of family health, health promotion planner, mental health, epidemiologists, public health researchers. So I gathered all these titles from past jobs that I've seen, as well as areas where I've seen some internationally trained physicians obtain employment. So what kind of skills do you need in public health? So the Public Health Agency of Canada has put out a document, and it's called Public Health Competencies, or Competencies for Public Health. So you can find that online, and it goes through over 60 different kinds of skills, but they've grouped them in these 10 areas. So you can see there's sciences, of course, There's assessment, analytics, policy development analysis, program planning, implementation and evaluation. There's public health advocacy, communication, partnership, collaboration, leadership, health equity, social justice, ethical, and reflective practice. So this document will go into in the details, as I say, 60 odd different skills. So depending on the kind of role, no one's expecting you're going to bring 60 different skills. So under each area, you'll see what is needed. So for example, I pulled out 3 areas. So in program planning, you can see the expectation is that you can plan, implement, and evaluate programs to address those root causes of health inequity and promote population health. And in working in different internationally trained physicians, I found that many of them have done outreach work. They see people coming into their clinic, they're trying to understand why they're seeing a certain condition, and they realize the need perhaps for reaching out to the community to raise awareness, to do education, and design a program that might make a difference. So I just mentioned that because I assume for some of you might have had that experience. Communication, all of you are involved in communication, I presume, unless you're doing some kind of a data. But even then, if you're doing analysis, I'm presuming you have to present it or talk to someone. So again, a critical skill to inform, influence, motivate, engage individuals, institutions, and the public to address public health issues. And then partnership is a really critical part. That is working with others. So again, I'm assuming in the health settings that you come from, you had to collaborate with others. You had to figure out things together. So again, in public health, that's really critical to build those kinds of partnerships and coalitions in order to influence health. So often it's other sectors that we need to work with because they may hold the levers that influence health. So I'm not going to go into this in detail, but just to know when you receive this presentation, it goes into more specifics around, okay, what do you need for a role in health promotion? And again, you would find that not only in the Public Health Agency of Canada, but there's an organization called Health Promotion Ontario, and they worked at refining these competencies. So again, you can see this partnership building, working with communities, knowledge of how to plan something, and being proficient in many languages, a huge asset, and having lived experience. So as we look across our province, it is so diverse, and having people who can understand, as we heard our earlier speaker talk about, hey, I can relate to you more because you've been through this kind of experience. So I wanted to do a quick poll again, just to see how many of you might have already had some of these kinds of experiences and skills and abilities. Not every role requires all of these skills, but we can see that some of you already are bringing those skills. So I'm not going to go through this in great detail, but what I'm trying to show you is, okay, on the left-hand side, you'll see work that you've done in a healthcare setting. And then on the right hand, how can you talk about it using terms and translate that into a public health world?
Counsel patients about medication, diet, or prevention.
Okay, so in public health, we would talk about, and you'd put this on your resume, that you've delivered health education using plain language and culturally responsive communication. So you can see, and I've seen this in physicians' resume, for example, they talk about, oh, I talk to patients about their medication. So someone working in public health, they're going to say, well, how's that going to help work in health promotion? So you can see how using the right terms can be helpful.
Manage patients with chronic diseases.
Okay, so in public health, we talk about applying knowledge of chronic disease prevention, determinants of health, and barriers to care.
Rounds, clinics, and team huddles.
Okay, so we would describe that as you've collaborated with interdisciplinary teams, you've prioritized needs, you've coordinated service delivery. And of course, in public health, because we're concerned about equity issues, it's important to talk about, have you worked with vulnerable populations, those that are marginal? Have you worked with different age groups?
Worked in infection control or safe clinical practice.
Okay, so we would talk about risk reduction, infection prevention, quality and safety practices. So you can, as I say, after the session's over, you can look more closely, but the idea is to think about the roles that you've played and those abilities that you have, and how do you use terms that would resonate in the public health world and in the, so that you can do that translation. And speaking of translation, if we can see there's all kinds of transferable skills. So whether that's communicating, presenting, writing, influencing, interpersonal skills, showing empathy. I'm sure all of you have that strength because it's something that you're required to do all the time. Initiative, resourcefulness, figuring out, how am I going to solve this? How am I going to get this done? Planning, organizing, problem solving, decision making. These are all critical skills in public health. Analytical skills, using evidence. So again, in public health, we're not just making up something like, oh, I see a problem, we should do this. We're going back to the evidence. What do we know about this? What works? What interventions are going to be most effective? And then that knowledge of health issues and conditions. And one of the things I would strongly encourage you to do is to keep au courant. So keep up with the news, whether it's newspapers, whether it's online, whether it's journals, because one of the unconscious bias you're going to face is, oh, you don't know our system. So you want to be able to show people without being asked, oh, I understand all the parts of the Ontario system. I understand the difference in public health. And looking at different issues, I know what's hitting the headlines, because this is where public health agencies and organizations are going to be focused on what's most pressing, what's getting attention, what are politicians concerned about, what is the public concerned about. So you want to show that you're up on the latest. So I wanted to take a moment and just look at a job description. So in this case, we see a Grey Bruce, which is around the Owen Sound area of Ontario. And oh, guess what? They're looking for a bachelor's degree in health studies. So all of you are way beyond that. So you meet that requirement. Sometimes you might see masters of public health or equivalent education experience. So again, you can certainly show how your experience and education meets that requirement. Okay, knowledge of health promotion practice, health status, populations, health inequities, health determinants. So it doesn't say that you have that ability, it's saying knowledge. So this is something you can read online, and you'll see in my appendix, there's a health promotion online free course at Public Health Ontario. So there's all kinds of resources and online training courses to make sure, like, oh yeah, I know that, or I know that, or I didn't describe it that way, but I get it. And then that ability to develop, implement, and evaluate community health-based initiatives. So we already have some of you that have said, hey, I've already done that. So for others, are there ways you can get that experience? Could you be volunteer, for example, at a community health center or a public health unit or a local health organization, a community service organization, where you might learn more about how are they planning initiatives that improve community health. And then this part, okay, leadership skills. Okay, so all of you, have been independent agents working with others, having to show leadership. So using your communication skills, assessment and analysis. So as those patients are coming in, you're doing assessment, you're doing diagnosis. So in a population health level, you're looking broadly, not just at the individual. What does this mean for the community? What are our chronic disease rates in the Kitchener-Waterloo area? And then that experience in building partnerships. So you can see in that job ad, you might say, hey, I think I could apply for that. One of the things I would suggest you do is to make sure before you start applying for roles that you ask someone who's been working in this area to give you some feedback, because I have seen people applying and feeling frustrated. Then I look at the resume and I'm thinking, oh my gosh, one gentleman I was talking to, he was describing a proud achievement, how in Pakistan he was in charge of emergency preparedness and flood. There was a huge flood, and he worked with all these international agencies. It's like, where is that? Another gentleman talked about a cholera outbreak. So as an employer, when I look at that, you say you managed a cholera outbreak. So I'm not thinking necessarily of the disease. I'm thinking, wow, that's a leadership role that has huge impact, and you prevented the spread. So it tells me a lot about your skills. So I've got two others, but I'm just looking at the time, and there's something you can look at. This is in a public health unit. This one is in a community health centers. So community health centers are a fantastic way to get your foot in the door, because they have primary care, but they also have health promotion, and they are 101 community health centers in Ontario. So you do want to read about those, and you can see more requirements, but also because they serve so many communities where we find many immigrants, refugees, newcomers, they really value people with different language skills who have that lived experience. And then we see in Mississauga, in a family health team, a health promotion specialist. So for example, you might be doing diabetes education there. So again, when you look at some of these concepts, you might say, yeah, I have those, or I feel I could easily gain those. So I did want to mention that for those of you that are internationally trained physicians, I have been working for the last 6 years with a program that is run by the Learning Richmond Foundation, and it is an online program. And we go through what is Canada's health system, Ontario's health system, principles of equity, health promotion, communication, social marketing, advocacy, integrating health promotion and healthcare. There's a whole range of topics. Plus there's also, as you see, business communication, career planning, a range of guest speakers. So it's something to check out if you feel that would be helpful for you. So as I mentioned, there are different places where you can go. Public Health Ontario has events. They have online free webinars. They have online course on infection prevention and control for those who want to specialize in that area. The Canadian Public Health Association is a good way to keep up with what's going on. They have newsletters, they have job postings, they issue reports on critical public health issues. On the next slide, you can see some other organizations I was mentioning. This is a young person who has a master's in public health, and they started this online place. It's got a career club. They do book reviews, newsletters, they post jobs. So it's a great place to go. Oh, there you go. So there you see. There's also these other centers across Canada, and for example, methods and tools where you can find lots of webinars, online courses, videos, reports. So again, great source for information. You can see the Alliance for Healthier Communities. They post job opportunities across Ontario working in community health. They have a free online course. Social prescribing is something that now people are looking at, the issue of loneliness, especially among seniors. And there you can see some other webinars and courses. And then all of you, I do encourage you, and one of the things we do about our course is a module on Indigenous health to understand why are we seeing this disparity among Indigenous people, and to understand that history and the things that happen, how colonization impacted Indigenous people. So again, there's a whole center there where all kinds of terrific resources. So I just want to conclude by saying there are a lot of challenges out there that now we're seeing that chronic diseases are the biggest burden, if you will, on a healthcare system. Yet we know something like diabetes, 50% of it is preventable through healthy eating and increasing physical activity. We also know those other determinants of health, though, could be the ones creating problems. For example, in Peel, Public Health did a study realizing the way urban sprawl has happened in the Peel area has made people more vulnerable to having type 2 diabetes. So understanding the role of the built environment, how to prevent those diseases and conditions, understanding the impact of climate change is going to have a huge impact. Already we're seeing it with Lyme disease, for example, increasing as the climate warms up. Those ticks are moving further north. We're seeing vaccine hesitancy, unfortunately, after decades of success, issues around young people in terms of addictions, mental health, and a lot of issues around misinformation and public trust. So in my mind, public health is like a ripple effect. You have that intervention and it has an impact across the broad community. It provides that opportunity to improve health, to create new knowledge, and to work with others, and often at a low cost, in order to impact a lot of people. So I hope through my remarks in terms of understanding what is public health, how is it different, what kind of skills that you need, where those opportunities might be, the transferable skills that you bring, that you will consider building a career in what I think is a really dynamic and exciting area. And I know that can be super challenging. My daughter sadly was laid off along with a number of her colleagues, and she's been looking since November. And so it takes a lot of persistence. And so I know you bring that determination, you bring so many strengths and assets. And so part of it, again, through Pegasus, this idea of finding a mentor, someone who can help translate, help you realize, okay, what is it that I'm bringing? How do I translate it in a way that the employer will understand? How do I tailor my resume, understand the job requirements? And then when I'm in interview, how do I speak with pride, but humbly, about what I've achieved and what I can contribute? So again, I wish you all the best. And it was my pleasure to be able to share my passion and knowledge about public health. And I'm happy to answer questions.
So much, Peggy. It was very informative, very comprehensive, and really, really appreciate it. I'm sure people might be having questions. After the event, you can have the recordings on website. So if you need to access this information, you can access them through the website as well.
That is a terrific question. And on my way down here, I was thinking, okay, what is the size of the public health workforce? And I used to have some data, for example, at the national level, there are thousands of jobs at Health Canada and Public Health Agency of Canada. And I think in public health units, again, you're looking at probably 8,000 positions in public health units, but we also have all these other organizations that are doing public health. So we're not counting health promotion in part of the healthcare system and in social services. What I have found, because I've been running this course now for about 6 years, I have found more job postings. So I find that encouraging and curious too, a lot more health promotion positions. So I'm thinking, okay, it must be that if you ask people maybe 30 years ago, health promotion was not as widely recognized and understood the role that it can play. So I think people are appreciating, wow, this is great to have a health promoter on our team. And I have seen more of those positions being posted in the last year than I have in the past.
Thank you, Pegeen. Is there any more questions?
Thank you so much. Internationally trained public health profession. Do you need to register here?
So you need to
Register to be a public health officer in this country?
every public health unit has a medical officer of health who oversees that health unit, and they would be licensed doctors and specialized in community and preventative medicine. So let's say you want to work in inspection, you need to be certified. If you want to work in infection prevention control, you need to be certified. If you want to be a health promoter, you could have a master's of public health, or you could have, it sounds like the experience that you have. So for example, I've worked for 43 years, and most of that has been in public health and health promotion. My background is political science. I am not a physician. I am not a nurse. So what I did learn working in government is how to get things done, how to bring people together, and all the knowledge I gained through working with experts and reading and attending events and what have you. So the skills were, my boss used to say, you have a can-do attitude, like how am I going to keep that? All this group that's fighting with each other, we want to deliver a child development program. How am I going to get everyone focused on that and make sure we're getting to the end result? So, and you can see dental hygienists, you're going to need certain credentials of public health nurse. But that's why I talked a lot about community health and public health promotion, because those are things I think it's easily transferable. I think also you'll find people go into infectious disease and communicable disease in public health as well. I know there's been some internationally trained physicians who have worked in that area, or public health nurses, for example. Yeah, so you don't need to be a licensed doctor to do a lot of some of this work. And other ones, they may be short-term credentials, and in some institutions, they will recognize some of your credentials and make that study time shorter if you want to. For example, I can't remember if it was reading about dental hygienists or one of them where they were saying they recognize international credentials, but there's some supplement that's needed. So it's going to vary depending on the role. But the jobs, all the jobs I've shown you there, they require either a bachelor's, a master's, or equivalent education and experience. So I think the point that you're bringing is that equivalent education and experience. And for example, I know some of you are interested in data, work in the data field. So you don't necessarily have to have, a master's in epidemiology. Again, you may be able to bring that experience that you have to take on a role that has to do with surveillance. So I understand there's a number of people online that have questions. So we're going to print out those questions. And then I presume we could post the answers somewhere. We could post the answers to those questions or comments.
Okay, yeah. So just to clarify, if I understand your question correctly, you are asking if internationally trained public health experts have to register here in Canada to practice. And the answer is not quite. It depends on the role that you are applying for. I don't believe that we have a centralized public health system that sort of certifies people. But like she mentioned, say you wanted to work in infection diseases, you might have to go through extra certification because IPAC is a centralized body. So you may have to apply for some certificates. But we don't have a big body that sort of registers internationally trained public health experts the way that we do for nurses and doctors and dentists and surgeons.
You got it. And again, it's my pleasure to be able to share my knowledge, and I wish you all the best. Thank you.
Thank you very much, Pegeen.